Welcome to Kaleida Health Medically Speaking and our special series on the fight against the coronavirus. As you can see, we have modified our format to practice safe social distancing while providing timely and factual updates from the Kaleida Health team during this public health crisis. We as a healthcare organization believe it's important for the Western New York community to hear from our medical experts who are leading the charge in our facilities and with our workforce of over 10,000 strong. I'm Mike Hughes, and this is Medically Speaking. Welcome, Jessica. Thanks for joining us today on Medically Speaking.
Thanks for having me.
So we wanted to talk a little bit today about environmental services, cleanliness in the hospitals, and housekeeping. So if you can, first tell us a little bit about what you guys are doing with these enhanced housekeeping measures.
Well, thank you. So with everything developing with coronavirus, we certainly wanted to ensure that we were enhancing all of the different things that our environmental services team is doing to protect our teams, to protect our patients. So we have implemented enhanced cleaning protocols, which essentially means we're following CDC and EPA recommended guidelines to make sure that we're hitting all of our high touch areas for cleaning. So things like doorknobs, bathrooms, surfaces in waiting rooms, and those areas that folks are touching a lot, and really making sure that we're cleaning those areas as frequently as possible.
And I know for those who are watching at home, everybody's going through this every day, whether it's at home or in their car or when they're going places, they're cleaning and disinfecting on a regular basis. Everybody's trying to stop the spread of COVID-19.
Mm-hmm.
But for a hospital, talk about the challenge of trying to keep, say, 500,000 square feet clean and disinfected at all times.
Yeah, it is a challenge. We're really thankful that we have an extremely strong team of environmental services professionals here who are very well versed in the types of processes and products that they need to use to keep things clean on a day-to-day basis. So being in a hospital environment, certainly it's something that we are thinking about all the time, but especially in times like these, having that workforce who's very skilled in working through those processes and using those products is extremely beneficial because they know what to do and they know what to use, how to use it. To make sure that we're being as clean as we can be. So really, thankful for those folks on our team.
So in a healthcare setting, there's an awful lot of high touch areas. Tell us a little bit about what that means and what those are.
Sure. So thinking about all of the different ways that people are accessing our hospital environments, coming in all different directions to be able to receive care, and we need to continue to provide that care. So it's really thinking about all of those waiting spaces, all of those entry points, every doorknob that you're touching when you're coming through, anything, elevator buttons, all those types of areas that a lot of different people are touching, not even just on a day-to-day basis, but all through the day, through the evening and nighttime hours, because hospitals are 24/7. So making sure that those high traffic spaces and high touch points are being cleaned frequently is of the utmost importance to us.
Gotcha. And you have some examples of some of the supplies that you guys use on a daily basis?
I do. So these are things that our team uses all the time. So different products that we use that are already verified by the EPA and the CDC to kill viruses like what we're seeing with coronavirus. So Virex Plus is something that our team dilutes and uses on a day-to-day basis. Different Clorox bleach products. Clorox hydrogen peroxide product is something that we're using to supplement some of the other products that we use day to day, and things like soft surfaces, thinking about all the different soft surfaces that are in our patient care areas and making sure that we're spraying them down to be, that extra level of caution from a cleanliness perspective.
So Jess, with some of those products that you showed us, you're using them in the high touch areas like elevators, handrails, doorknobs, but they're leaving some streaks, but that's by design. Tell us a little bit about that.
It is. So sometimes what we say is streaks mean clean. A lot of the products that I was showing you and speaking to really do require a dry time. They need to air dry in order to really do their job to disinfect. So a lot of times what happens is once they air dry, they do leave some of those streaks. So that is, as you said, by design.
Gotcha. And as we wrap up here, I know you guys have a philosophy across the organization. It's not just one department that's responsible for helping keep things clean and disinfected. There's really a philosophy of it's a team approach. Tell us a little bit about that.
It is. And something that I know our team says a lot is housekeeping is everybody's responsibility. So it's really, our environmental services team is out there in force. We're doing everything that we can to keep all of those high touch surfaces clean and go through our day to day. But we really need the support of all of the teams to do that same thing. Individual workspaces, computers, anything that individuals are touching a lot in their day to day, it's always helpful to be able to wipe those surfaces down when you're handing off to somebody else or as you leave a workspace. Just an extra pair of hands and eyes on things to be able to make sure that we're keeping things as clean as we can.
Well, Jessica, thanks again for joining us today. I know these are trying times in healthcare. Thanks for all that you guys do, and thanks for helping keeping our healthcare workforce safe.
Thank you.